Let's take a look at the section on proximal contact areas. We're going to see about 8 or 9 questions on this next section here. Right off, I see about 4 general rules there. Right in your book, I want you to highlight that they prevent food impaction, they form embrasures, they protect the periodontium, and they stabilize the dental arch. You'll see this commonly in a checklist and a question on the test. Now let's look at the diagram and we'll dive into some details. Taking a look at these diagrams, you'll see some things we want to generally note. As you move posteriorly, contacts move more cervically. Contacts are never located in the cervical third. From the occlusal view, contacts are facial to the buccolingual midline. This is true for all posterior teeth, but not true for anterior teeth. Anterior teeth, they're more centered. One question we keep seeing on old tests refers to this mandibular model. Take a look at the mandibular arch and note that from the second premolar to the second molar, the central fossas form a straight line. Remember that mesial groove on the first premolar? Well, it has a big clinical significance, so expect to see some questions here. There's a very large embrasure formed between the canine and that first premolar. Remember the distal incisal curve of the maxillary lateral? It forms the biggest incisal embrasure. The smallest incisal embrasure is between the centrals. As we look at this image, note that all posterior contacts are always in the middle third. In the maxillary, they start high and they begin to step down. In the mandible, they start high in the incisal third and then drop down to the middle in the canine. In terms of heights of contour, there are 2 main things you need to know. The facial height of contour is always in the cervical third. In the lingual height of contour, in the posterior it's in the middle third, and in the anterior it's in the cervical third.